Good afternoon or good morning, everyone. My name is Jeff Horwitz. I'm the Chief Executive Officer here at Safe Project, and I'd like to welcome you today to a very special webinar in celebration and in education of the value and importance of Recovery Month. Today's presentation is Conversations Across the Continuum, Bridging Recovery and Harm Reduction, and it features an incredible panel, including our guest moderator, Regina LaBelle. I know that we will have introductions as the panel builds out, but I do want to personally thank Regina for coming here today. If you don't know much about Regina's background, she is currently the director of the Center of Addiction Policy at the O'Neill Institute at Georgetown Law, and she is actually former acting drug czar of the United States as well as chief of staff for ONDCP under two separate administrations. So, Regina, thank you very much for your public service, your incredible work, and for being here today to help us through. Within a few days after the webinar, you're going to receive an email with a link of the recording of this webinar. And although the presentation does not qualify for continuing education credits, attendance certificates will be sent out in the next 2 weeks or so to all those that attended for the full length of the live webinar. During the presentation, we would ask you to provide all your responses to reflection questions or any other questions you have into the chat. Hopefully, we'll have an opportunity to answer some of those questions, but I suspect this is going to be a very robust panel, and they'll have lots to talk about. With all that said, before we get started, I'd like to share just a wee bit about Safe Project so you know what we do and why we're doing this presentation. Safe Project is a national nonprofit that is committed to overcoming the addiction epidemic in the United States. It was established in 2017 by Admiral James and Mary Winnefeld after the tragic loss of their 19-year-old son, Jonathan, due to an opioid overdose after 14 months of treatment. Safe Project aims to save lives impacted by substance use and mental health challenges through the overdose prevention and response, education on stigma, and development of prevention and recovery programs. Safe Project also provides tailored guidance and training in its 4 key initiatives, which is Safe Campuses that works with colleges and universities, Safe Communities that works with communities large and small, Safe Workplaces that goes into individual businesses and helps them, and Safe Veterans that work with our active duty veterans, caregivers, and their families. To learn more about Safe Project, please come see us at www.safeproject.us. And before I take my face off the screen, I'd like to introduce the head of our communities program. Safe Project's community director of Safe Communities is Rachel Bowling. Rachel, why don't I kick it over to you?
Thank you so much, Jeff. Yeah, and similarly, I just want to thank all of our panelists, our phenomenal moderator, Regina LaBelle, Safe Project, and everyone in attendance for being part of this important conversation. So I am going to, first of all, minimize some stuff so I can see. And I'm going to walk us through some level setting slides to help frame why we're centering this topic today and just some key data and dynamics shaping both the tension and the possibility between recovery and harm reduction. So, as directly as I can put it, periods of abstinence are strongly linked to increased overdose risk, and with the policy shifting toward incarceration, civil commitment, and disinvestment in tools like naloxone, that risk, is unfortunately likely to grow. It's really clear that harm reduction and abstinence-based communities can no longer afford to work in silos. Our shared goal is to improve health outcomes and ultimately to save lives, and that requires real collaboration, not just philosophical alignment. So, first and foremost, let it be said, celebrated, shouted from the rooftops. Just because periods of abstinence can increase the risk of overdose, that does not mean that abstinence isn't a valid and vital pathway to recovery. Millions of people have successfully overcome their substance use disorder through mutual aid models, be that Alcoholics Anonymous, Narcotics Anonymous, Refuge Recovery, etc. And also, many of these models are available for free at local community centers, which is hugely important given the reality that substance use disorder disproportionately impacts the economically disadvantaged. Also, I'm moving through these a little bit quickly because I really want to get to our panelists, but if you do have questions related to anything that you see on the screen, feel free to throw them in the chat and we will get to them time permitting. So, at the same time, when abstinence is a valid and vital path, when it becomes a gatekeeping requirement, rather than a personal choice, it can create real barriers to care, to employment, to housing, and to safety, right? Especially for people navigating complex or nonlinear recovery journeys. An example of that is the peer credentialing requirements across the United States. So, as of 2023, you can see here 47 states require certification bodies to verify an applicant's lived experience with substance use recovery, and that is generally translated to mean required periods of abstinence. Um, and unfortunately, those definitions tend to exclude individuals who are using medications for opioid use disorder or who are practicing harm reduction. And unfortunately, this can lead to peers choosing not to share their struggles, right, for fear of reprisal, up to and including losing their employment. And this is in a profession that demands or makes really extreme emotional and psychological demands. You can see, though, too, that the landscape is changing a bit. SAMHSA is emphasizing recognition of multiple pathways to recovery and discouraging abstinence-only definitions. Another example, right? Many recovery housing initiatives, peer-led spaces, detox programs maintain abstinence at entry policies, meaning you cannot be under the influence of anything if you intend to enter into treatment. So this effectively excludes individuals actively using substances, even when they're doing so safely. And the reality is that many of these people rely on substances to manage acute symptoms, or even just to engage in services at all. And just like abstinence can lead to improved health outcomes and in quality of life overall, harm reduction too has documented exceptional statistics on the effectiveness of its interventions. As you can see here, SSPs, syringe services programs, reduce transmission of HIV and Hep C by up to 50%. Individuals who access them are 5 times more likely to enter treatment, 3 times more likely to cease injection use. And OPCs, while we don't have a ton of them in the United States, demonstrate a lot of success in reducing fatal overdoses. And same thing as SSPs, participants are significantly more likely to enter into treatment if they access OPCs. So, all of this to say that both ends of the recovery continuum, both abstinence and harm reduction, share a common goal, which is to keep people alive and to improve health outcomes for vulnerable communities. Still, a real and understandable fear persists on both sides that the other way might do harm, right? And that fear often manifests as division or as mistrust. And what makes substance use disorder uniquely complex is that each case exists at the intersection of biology, trauma, identity, and meaning. And like other treatable health conditions, it requires care, but unlike most, it also demands that we confront ideology, morality, culture, and ethics. And if we are serious about our shared goals, we have to acknowledge where we've failed to hold that complexity and commit to building systems that embrace nuance and not just compliance. And today's conversation is about how we might do exactly that. So I'm going to stop sharing and then introduce our wonderful moderator first, who Jeff already did a pretty good job. I'm not sure I can top it. But Regina LaBelle, she served as a political appointee for 2 U.S. presidents and the mayor of Seattle. She's committed to developing effective strategies grounded in science and evidence to curb addiction. At Georgetown University, Regina created and directs a unique Master of Science in Addiction Policy and Practice. She is a recognized public policy expert, and Regina has testified before Congress and is regularly quoted in the media, including appearances on MSNBC, CNN, and the BBC. Now on to our wonderful panelists, first of which is Kimber King. She is the operations coordinator for SafeSpot Overdose Hotline. SafeSpot is the nation's first and only professionalized 24/7 peer-led overdose detection and prevention hotline. The model is simple but powerful. They sit with people while they use drugs, and if an emergency arises, they activate help. An overdose and drug war survivor, Kimber King refuses to stay silent. She channels her lived experience into urgent, compassionate action against preventable overdose deaths. Next up, we have Mark Yocum. He is a harm reduction coordinator for a local nonprofit in Western Massachusetts. He specializes in harm reduction and street outreach, using his past personal experience with substance use disorder to support and empower others. Through his work, he strives to make a positive impact in his community and promote a more inclusive and compassionate society by reducing the stigmatization and marginalization associated with substance use. Third on our roster today is Phoenix or Mohawk Kelly. Pronouns they, them. They are an intersectional harm reduction educator and advocate for people who use drugs that has provided in-person peer support services and online education and resources for over 10 years. They are a member of the Youth Rise board and have held leadership roles at Next Distro and Dance Safe while producing and operating harm reduction projects and services. They've performed various drug checking operations in 6 countries, including the first of its kind in South Africa, Guinea-Bissau, and Sierra Leone, most recently assisting the National Lab in Senegal in synthetic cannabinoid identification. And finally, we have Noel Sierra. Noel is a Latino man in long-term recovery. He has been working in the recovery community since 2015 as a house manager, a recovery treatment coordinator, a recovery coach, and a recovery coach supervisor. He began his work at the Massachusetts Organization for Addiction Recovery as the Southeast Regional Coordinator and is now their executive director. I cannot tell you how thrilled I am to have all of you here. And with that, I will stop talking and pass it over to Regina so that we can begin with the actual panel. Thank you all so much for being here.
Thanks, Rachel and Jeff, and thanks to SAFE for having this discussion today. So, I look forward to hearing also if folks in the audience have questions, they can put them in the chat, and we'll be taking those after we have a conversation with the panelists. And I'm really, it's great to be joined by folks who are doing such important work in their communities. So I think what I wanted to start with is just asking folks, each person in turn, each panelist to tell me how you describe harm reduction and how you describe recovery. And since Kimber, you're on my right on this list, we'll start with you. If you could just talk about your personal definition of these two terms.
Nice to see you, Regina. I've heard so much about you, and I've never been in the same space as you, so it's really good to see you. For me personally, recovery is just, and harm reduction is any positive change. Um, as a person that used IV drugs for years and years, when I needed harm reduction was there for me. It kept me alive, and it was part of a whole continuum of care in my recovery. Um, so personally, after I decided I didn't want to be doing drugs anymore, the only path that was really given to me was AA or NA, and I grabbed onto it like a life vest, and that worked for me in the beginning to get sober, and now I continue an abstinence-based recovery. Um, yeah, so for me personally, it's just, no matter where you are in that period of your life, like there's just a different thing for you to use.
Thanks. Mark, do you want to tell us your personal perspective on these terms and the approach?
Sure. I'm right there with Kimber. It's any positive change, basically, right? Recovery, I was told by Jim Wolfling years ago that recovery is whatever you want to call it. I can't tell you what your recovery is. I can't call it anything other than it's your recovery. And I respect that. I appreciate that. What I was always told recovery was 100% abstinence. As time has gone by, I've learned that is not 100% accurate. For me, I am abstinent, but that's also my harm reduction. And for me, harm reduction is simply, exactly what it says, reducing harms. A lot of the things that we do create harm. Whether it could be a multitude of different things. Whatever we need to do that reduces anything that can be a danger to us or harmful to us, that's what we got to do. I mean, it's so simple as we have smoke alarms in our homes, in our apartments, and that's harm reduction right there. So it's an everyday thing. We definitely, those of us in the quote unquote harm reduction community look at it as in a little different lens. As long as people have safe supplies and everything like that, that's all it is. All I want to do is let people live. Let them live another day. I don't care if it's 100% abstinence based, reduced use, or whatever. Just live to see tomorrow.
Thanks, Mark. Mohawk, do you want to go next?
Sure. I feel like everything I wanted to say has already been said. Any positive change, might as well just say it a third time, make that stick for everybody. That's for both recovery and harm reduction. But I'd like to share a partial quote that I'd like to go off of. It's not exact, so I just don't have it memorized like that. But Frank Sinatra once said, "I'm for anything that gets you through the night, whether it be a bottle of Jack Daniels, a tranquilizer, or something of that sort." So that's kind of like how I look at, substance use in general. And that, also includes harm reduction. I've not ever formally done recovery or like rehabilitation programs myself, but I've used harm reduction as a way of weaning myself off of things, tapering back. When I was concerned for mental health or physical health of myself or the others around me, I found that that's most successful for me because I'm not in a place where I can confidently say I can get through every day for the rest of my life without some sort of substance use. And so, I find harm reduction to be very flexible and, reducing these harms, reducing these risks. And also, like, I'd like to look at harm reduction as a way of maximizing the benefits of the usage of these substances. I don't want it to always be framed as like, oh, it's only ever causing harm, and therefore we have to prevent some of that or mitigate some of that. I think with these tactics, these sort of like modalities, we're able to cater it to something that's overall productive and positive for our well-being. And I do want to see recovery merging more with that as well, because for some people, like Mark, the harm reduction is abstinence. For me, maybe not quite yet. Maybe someday, but not yet.
Thanks. And Noel, do you want to go next, please? And I promise I'm not going to do you all in the same order so that, and I want you all to speak up for the next questions. But Noel, your perspective on these terms.
Hi, Regina. Thank you so much. When I think about recovery itself, it is a process of change, and it's an individual process of change because recovery is different for everyone. There's not one person that has the same cookie cutter process of recovery. So, when I look at recovery, it's different for everyone. I identify as a Latino man in long-term recovery, and that was different for me than it was for many other folks. And when I look at harm reduction, Mark clearly said it. It's being able to keep people healthy, safe, but also being able to keep folks alive. You can't recover if you're dead, and that's the ultimate idea of harm reduction, is keeping people alive.
Great. Thanks, Noel. I think we've all you all have said, any positive change kind of is the underlying tenor of what we just talked about. But it's not always, the folks here, you all kind of have some threads that you agree to. That's not always the case, right? And so let's talk about, any of you can go first. How does that tension between harm reduction and recovery sometimes manifest? How have you seen it? And I'll open that up to any of our panelists.
There's that awkward silence that I was talking about. We knew that was going to happen. I'll just kick it off that, a lot of times, whether it's on social media and somebody makes a post about something, you'll have folks from one side kind of maybe bashing the other side for their comments and disagreeing and things like that. It's really kind of wild like that. But one of the things I've noticed is that so again, abstinence was and is for a lot of people the one and only goal. It seems like if that's what you're led to believe, um, if that's your whole theory on everything, then we should be able to understand that that's not going to be the same way for everybody. Um, a lot of times when I was in meetings through 12-step recovery, if I brought up any type of harm reduction, if I even so much as brought in Narcan to meetings, which I used to do, people would tell me I had to stop talking. People would actually take the Narcan and throw it away. It was pretty wild, the things that happened. And it was like, we're not, I don't think we should be butting heads like this. I think that we should be actually helping each other. If that's your pathway to recovery is abstinence or whatever, awesome. That's cool. Hey, I'm down with that. If it's working for you, that's great. But when people start to tell you how to do things, that's when, at least for me, I ended up leaving 12-step recovery after about 3 years because I believed, a lot of my friends were dying from overdoses. And these were people that were telling me and telling everybody in meetings that they were abstinent, which in reality they clearly weren't. They just didn't feel comfortable telling anybody. And when they started dying, I was like, this isn't for me. I want to make sure that I help people in whatever way I possibly can for, and mainly respect for the people that helped me get to where I was at that time and where I am now. So it's just really weird to me how it's not it's people think it's one way or the other, and it's not. We can all work together, and a lot of times the recovery community is working with the same people in the harm reduction community. It's all the same type of work. But it just seems like a lot of times the people that are on, you know, whichever side you're on, sometimes they just take it to the extreme and don't actually look at what other people might be using. And then all of a sudden they may feel defensive and start to feel like, oh, I need to support and show my support for harm reduction 100% here. I need to make a comment. I need to do something. Um, I don't know if that all makes sense. I feel like I may have rambled a little bit there, but it just, there should not be this headbutting and clashing as much as there is sometimes.
Thanks. That was a very specific example of that tension. Noel, you went off mute. Do you want to talk about that as well?
Yeah, when I first started working in this field of recovery, like I said, I'm a person in long-term recovery, but when I started working in this field, even myself, when people would talk about, medicated, assisted recovery, and this was a pathway that people would use. And I found myself having this bias. And I found myself even within my own thought process saying, oh, they're using a drug to get off another drug. I found myself having this same thought of, even harm reduction. All right, so they're going from a 30 pack to a 24 pack to a 12 pack to, okay, a 6 pack, even though, and then substance, now we're talking about narcotics and so forth. And the idea is, being able to educate the community. I had to educate myself. I had someone give me a book and said, read this book, Noel. And when I read the book, I sat back and I went, oh, snap, that works, but I had to take the time to educate myself. We're so caught up in looking at things through our particular lens that we're not open to being able to recognize what worked for me is not going to work for the next person. It might be a different pathway. Harm reduction is going to help that individual. And Mark, you said it clearly when you first talked about harm reduction. It's whatever it looks like. Did you brush your teeth this morning? Guess what? That's harm reduction. Did you snap your seatbelt on when you went out for a drive? That's harm reduction. So it's being able to identify the things that we do and the things that help individuals as opposed to like even looking at it myself and hearing people say the same thing. But this is a I thing. I had to educate myself. I think it's about time that the community gets educated and or stop looking at it through a certain lens and take the time out to educate yourself. What is my bias? Why do I have this bias? And what can I do to affect change? We're supposed to be individuals that impact change and make change. How can we do that if we're looking at everything through one lens? We have to kind of educate ourselves to be able to look at it in a broader perspective, because then we would look at harm reduction as what works for me may not work for them. What works for them may not work for this one. everything's different. So we have to be able to say, hey, you know what? Let me stop. Let me take a pause. And even check yourself. Why am I looking at it through this lens? How can let me educate myself? And I think being able to educate the community, educate individuals, educate providers is being able to actually open and broaden our horizons in the way we think at looking at these things.
Thanks. Mohawk or Kimber, do you want to add anything?
Yeah, I just wanted to like quickly add, like with my experiences with like facing tensions with, I guess, some of the recovery community, it tends to be from two particular types of folks, like either people who have been through recovery and now they're abstinent and I don't know, are sort of like on a high horse about it now and think like, oh, I did it this way, so that means you can do it this way, and they get really sort of just like become zealots in this way, and really kind of like dogmatic, and also folks who generally tend to be Christian but could be other religious beliefs as well, where due to their faith they might have certain biases around, ingesting things of this nature that may not be seen fit for, whatever it is they believe. And so like I'm not a person who can navigate that very well. I have religious trauma and I try to stay away from all of that stuff. But like as Noel was saying, it's just a matter of educating. And I see some comments in the chat about doing education. I think I'm just bringing this up because I think these are things to think about when we're trying to have these conversations that are bridging these gaps between these communities. Because I'm most often having to sell people who don't like any sort of drug use, like they've never used drugs, or whatever drugs they use, they feel like that's not the problem. I'm usually educating people on that end of the spectrum, not people who are like recovery advocates or recovery workers specifically. So I feel like, I've always considered myself like the used car salesman of harm reduction, because you have to find something that will sell this person on this thing that maybe they're on the fence about, or like are really not interested in. And so, sometimes you have to take into consideration, like, why is it that they have these beliefs? So what is it that I can show them or say to them that will help them hopefully open up their minds? Obviously, not everybody can change their mind, but I've definitely had a lot of success in talking with people, identifying like what is their hang up and how can I sort of, provide a defense. And my dad's a lawyer, so like I've always had to figure out like how do I basically convince this person of my side of this particular topic. And that can be really hard, but I think that's also like something that all of us should work on, and also just um yeah, just like work on it and be mindful of it.
Great, thanks. Kimber?
Everybody had really great things to say, and just piggybacking off a little bit of what Noel was saying, most of my days at Safe Spot are now I'm going to different programs and educating different programs on what Safe Spot is, how to teach people about the hotline, how to walk people through overdose prevention in that way. And I being, someone who got sober through AA, but work in harm reduction, like I kind of settle both worlds all the time. And it really, where I see kind of like the clash in the two, we have a lot of programs that we go to and try to educate their staff on how to teach their clients or participants about the hotline. And they will refuse to give any of our information. They refuse to hang up posters. They refuse to hand out cards. They refuse to let us come in and do patient-facing groups. And because most rehabs or detoxes are all abstinence-based AA like modeled after AA. Like that's what they're giving people to stay sober. And I really, it really makes me sad because you're, being a person who's been in multiple rehabs, like I can see just by looking around, like most people are going to leave there and use drugs again. And if you're not giving people all the proper tools and giving them all the proper education on what to do when they leave there, you're really only hurting the people you're saying that you're trying to help. But yeah.
Oh, Regina.
Sorry. Yeah. I want to talk about the, can you all give me any or give our audience any examples of, when policies or funding streams or program design, and Kimber, I think you kind of just touched on this, when policies have kind of posed a barrier to bridging harm reduction and recovery, because I think, Kimber, I think people are afraid that it will encourage use, right? That's where it kind of, that barrier exists. So anyone give any examples of, in your experience, a time when a policy or a funding mechanism or the way a program is designed pose that barrier to what you're trying to do, which is any positive change, to bridging harm reduction and recovery? And anyone is welcome to speak up first.
In the state of Massachusetts, there are 0 overdose prevention centers. New York has 2. Rhode Island has 1. Vermont just voted for 1 last year, if my memory serves me right. When you look at overdose prevention centers, right? There's an argument. There's a going back and forth. Perpetuating the use is one of those arguments. But then it's a question of, okay, what's the process look like? Have you taken the time and the energy to look into what the process looks like? In Massachusetts right now, there's a bill that's being presented at the State House. So we're talking about policies now. You're right in my wheelhouse. So we're going to talk about the OPCs for Massachusetts, okay? In the OPCs in Massachusetts is the overdose prevention bill that's before the Senate, or before the Congress, before the House of Representatives and the Senate House. And the argument is that it's going to perpetuate the use. It's going to perpetuate drug selling. It's going to, increase more. But the idea is you get an individual that walks into an overdose prevention center, you're keeping that person alive. For a person to walk in through the doors of an overdose prevention center, it's basically saying they want to live. You know what I mean? And so it's an understanding of, and I just had this conversation today, if you had the opportunity to ask every person that has overdosed and passed away since 2010 in the state of Massachusetts, over 23,000 people, okay? Just that alone is mind-boggling. You'll argue the case until it touches your doorstep. You'll argue against it until someone in your circle is affected by this. And the idea of saying that an overdose prevention center is a harm reduction process, because I can't tell an individual when to go into treatment. But here's the thing that we don't look at. When we're actively out in the streets using substances, and I say we because I was there at one point in time myself, right? When we were actually out there in the streets, we burned every bridge imaginable. Friends, family, loved ones, we burned every bridge. So who did we have? We had the people out in the streets with us. Those were the only people that were tight with us. So we have literally no other connection. When you walk into the doors of an overdose prevention center, the harm reduction specialists that are there, what's the first thing they're going to do is they're going to bridge the gap that's been broken for us for so long. They're going to create a friendship. They're going to create an allyship. They're going to create a relationship. And the harm reduction, ideology is you put that hat on. You're greeting an individual. You're talking to them like, listen, I don't care what your situation is. I want to know how you're doing today. I want to build a relationship with you. You build a relationship with a person, you're creating relationship. The opposite of addiction is connection. So you're building a connection with someone. You're building a relationship with them. And that person may use today and be gone, but that person will come back because they remember you. You're building a relationship. That's harm reduction. That person can come back 27 times, but we just don't know if the 28th time through that relationship building, if they're going to choose to go into treatment. And this is the idea of doing no harm, keeping that, like Mark said earlier, keeping that person alive. You can't recover if you're dead. You can't recover if you're dead. Yeah, ask the 23,000 if we had a chance. Would you rather use a loan, or would you rather use some place where they're going to keep you alive if you go to an overdose? That's harm reduction. And being able to look at the idea of other individuals, right? Theodore Giselle, 26 times he tried to get a book printed, 26 times, but he kept going to the printers, trying to get the book printed, 26 times, got turned away. And the 27th time, someone looked at him and said, you know what? Let's take this book, let's print it. But if it wasn't for that 27th time, none of us would have heard of Green Eggs and Ham and Sam I Am. Why? Because somebody took a chance. Somebody had an opportunity. Somebody saw something. And that's what harm reduction does. It gives an individual an opportunity to say, hey, you know what? Maybe today, because somebody treated me with respect, because somebody built a relationship with me, maybe today I'll choose treatment. Maybe today I'll choose recovery. It's not our choice to make, but it's our choice to give someone that opportunity. And that's what harm reduction does. It gives an individual the opportunity to choose treatment when they want to, when they're ready.
Thanks, Noel. Anyone else want to comment on those barriers between harm reduction and recovery that may exist?
I will. So I will just say that Noel and I both were in Boston a couple of weeks ago for the OPC bill that is out there, and a lot of support. Fantastic people were up there speaking, but we have a long way to go because there's some people that were just stuck in the Stone Age with this and don't want to move forward. So enough of that. But I will say this, that one of the things I see here in Western Massachusetts is we have a lot of great recovery centers. Absolutely amazing. However, one problem that I see constantly is that they do not allow people to walk into the recovery center under the influence of whatever substance. They want folks to be 100% abstinent when they enter because they use the word quite a bit of we don't want to trigger the guests or the participants that are in there right now, which I understand. I can respect that. However, do we also not realize that the individual who just walked in through those doors, who may have alcohol on their breath, may be a little bit amped up, maybe they had to use a couple of shots of vodka or, smoke a little crack or take a couple of pills just to get the courage up to walk through that door. And for me, once I had any type of substance in my body, all of a sudden I was like, all right, I feel like I can do anything. So maybe that's what people need. And if you're a true recovery center, you accept people in whatever condition they are. And you know what? If they are in a little bit of bad way that might be troubling, then you help them. Maybe they need to go to the hospital. Maybe they don't. Maybe they just need a glass of water. Maybe they need to use the bathroom. Who knows? But to tell people that, oh, I'm sorry, you smell like alcohol, you're going to have to leave, that is another point where there is a massive conflict, at least in my mind, that there's a separation between the two. Harm reduction to me, I have guests come into my office constantly that are under the influence, and they're more than welcome to come here. I will give them something to eat. I will give them a glass of water. I will do whatever. We'll sit and listen to music if we have to, and we can talk about the Patriots, whatever we got to do. It's just to let them be themselves. I would never, ever turn somebody away and say, well, you know what, when you're sober tomorrow or before you start drinking tomorrow, come and talk to me. If you're not doing that, then I don't want to talk to you. Those are things that are big time barriers, and I see it all the time. And again, our places out here in Western Mass are phenomenal, but there is that one little thing that could get better.
For example, Mohawk.
Yeah, I wanted to just comment on like like funding streams and whatnot. Everything that I do is basically like, crowd funded and whatnot. But I do speak to a lot of people who are in like formalized programs and health departments and things that often, gripe about like, oh, there's so much paperwork, there's all these restrictions, there's all this red tape. We're just trying to, help people. We're just trying to do, this work. Like I know with a lot of funding streams, it's like it's hyper specific to like what types of services you can provide or resources that you can give. I know some drug checking programs where the drug checking technicians have to like ask for a lot of information that they don't necessarily want to ask of their participants, or offer up a lot of information to, the city or whatever governing body around the program that they don't really want to have to give up, because, a lot of people who are coming into these spaces may have, troubled history, and it might make the services feel less accessible because now they're not as safe, they're not as private, they're there could be information that puts them into maybe potentially like incriminated sort of position, like, someone who's undocumented or someone who's got warrants out for whatever reason. When I, was working with Next Distro, a lot of the like one of my primary responsibilities was just like the privacy of the participants who enroll in the program and are requesting harm reduction materials, like, cookers and sharps and test strips and whatever, cottons, all these things, some of which could be considered illegal in states that we were sending mail to. And we did not want to put any participants in a position to have that any information about them compromised, because we're using platforms that we don't own, sort of like basically we don't own that data. It could just be like, hey, if some enforcement agency wants to subpoena records on some of our participants and it's, chilling in like Google or Facebook or something, those companies are just gonna be like, yeah, sure, here, have it, and protection is really important in doing this work, because, a lot of people, as a person who primarily does drug checking these days, some people don't even want to walk up to this service, because they're just like, is this some sort of like entrapment? Are people watching me? Are things being documented on my being here? And then there's also a lot of programs where like they can't even get the funding to do this stuff without agreeing to terms that might, put their participants at risk. And it's tough. It's tough, so I just wanted to like talk about that because, yeah, obviously I think the policy stuff, very clearly there's lots of policies out there that suck. It's not like helping us move forward. And we saw, was it Washington State? I always get Washington, Oregon mixed up, but they basically, rolled back the whole decriminalization of substances because they were like, well, this didn't work because, well, yeah, you didn't really put all the pieces in place for this to be a successful, sort of like initiative. And they just gave up on it. It's like, well, see, told you this wouldn't work, and that's not where we want to be with any of this.
Thanks, Rohak. I mean, certainly, the issue of privacy protections that you raise, and also just concerns that people have, even if the information is protected, there's still misperceptions and fears that people have about sharing that information that can stand in the way. Kimber, did you have anything else to add?
I don't think I have anything on this, no.
Okay. So I want to turn it over. I'll give folks put your questions in the QA and I'll bring those up. We have about 15 minutes left. So while I'm giving folks time to put their questions in the QA box, I did want to ask, Mohawk, you called yourself the used car salesman of harm reduction. And I wanted to ask you perhaps to talk about, and anyone else, how do you address the argument that a lot of people have that harm reduction is an enabling practice? How would you address that issue, and certainly anyone else chime in as well?
Yeah, I feel like we kind of touched on this already. I believe Noel did, in saying, like, hey, we're keeping people alive here. We're giving people space to be able to use this safely. We're giving people resources to be able to use safely, so that maybe one day, if they do want to get to a place of complete abstinence, from these substances, that they have an opportunity to do so. And I think that that's kind of like one of the most compelling things that you can tell someone. I mean, a lot of times folks are concerned about, oh, there's going to be junkies, quote unquote, hanging out around these neighborhoods where the OPCs are, and now there's going to be needles and this and that. And I'm like, well, without the OPCs, those things are already happening. So, it's better to have facilities that can make sure that these things are being mitigated, versus like having nothing, to where you can see that now you might have, outbreaks of all sorts of, like bloodborne diseases, or, just like higher crime rates, things of that nature. You could see it with lots of different countries that have implemented different types of programs, like I believe it's Switzerland, and they're like heroin kind of like treat, that's their form of medication assisted treatment. Is like they just give people the heroin until they wean off the heroin. Like these things work. There's data around it, and even if the data is a little bit too much for people to kind of process, just explaining like, hey, like, no one's doing this because they really want to. If you are dealing with a substance use disorder, something is lacking. Like they said, connection is the opposite of addiction. So, something is lacking there, and stripping them more of resources or humanity is not going to be the solution to that.
Thanks. Any other sales pitches? Noel?
When I think of harm reduction too, you know, you look at the different states and the value that comes with harm reduction, right? What is harm reduction? Well, clean needles, clean works, making sure that individuals are using safely, right? So the idea is, when you look at the infectious diseases that come from intravenous use, when you look at, shared needles, dirty needles, when you look at harm reduction, you stop the spread of, those diseases, what HIV, Hep C, endocarditis, and just looking at also cost effectiveness too, and how that would help some, certain states. When you look at, what would it cost for an individual to get Hep C treatment? For one individual in the state of Massachusetts, it goes anywhere from, if I did the numbers correctly and I did the resource check correctly, it goes anywhere from $54 to almost $80,000. That's just one individual to get the complete treatment of Hep C. And if you look at that, in some of the statewide, they're only allow individuals to do this one time, and so to look at the idea of stopping the spread of, these infectious diseases, the cost effectiveness as well. You're stopping the spread of HIV. You're stopping the spread of, endocarditis. You're stopping the spread of hepatitis C and HIV and AIDS. And so to be able to do this in a way that you're actually helping your state as well, it's another side of the argument. you know? So there's two sides to the coin, you know? We can sit here and go to bat with individuals, and we do sometimes, you know, but it's all about bringing the education to kind of help individuals. If you don't know, then you don't know. But if you know, now you know, it's like, what do you do with what you know? You know, do you want to continue to keep arguing back and forth, or do you want to take the information that we're giving you and educate yourself and therefore have a better understanding of what harm reduction can bring to the table?
Thanks. So one of the questions, comments was about the efficacy of AA-NA meetings and how much they vary. And the questioner had, that just expressed a concern about hearing negative things about mutual aid meetings, not everyone's experience. And I don't know if anyone else wants to talk a little bit more about that or respond to the concern about kind of about characterizing AA or NA meetings in a certain way. Does anyone want to take that one on?
I will.
Thanks, Mark.
So I will preface this by saying that my experiences are my experiences in 12-step meetings. While I do, hey, they work for people, that's fantastic. I will never knock AA, NA, Smart Recovery, none of that. If that's the way you want to go, that's the way you want to go. And if it's working for you, who am I to tell you otherwise? I will also just say this, that there's a lot of fantastic meetings that I've been to, and I would recommend them highly to other people if they wanted a meeting in Western Massachusetts. But there's also meetings in Western Massachusetts that I would tell people, this was my experience there, and go figure it out yourself. But these are a little bit better and more understanding. I've been to some great ones, and I've been to some not great ones. Um, I can't knock the individual who's making the comment about feeling how they feel. But also, my experience and other people's experiences are also valid. So if you want to defend your pathway, awesome. Just like I will defend mine as it's strictly my own, right? So this is part of where we say that there's a conflict between the two, right? Somebody made a comment about how they feel toward these meetings and things like that, and recovery centers and OPCs. And then there's the other side that feel, well, this is how I see it. And this is what we have. This is why we're having meetings like this and webinars like this. And this is where we should be able to sit down and have open discussion about this. Again, AA got me sober, man. They got me at my feet on the ground. 3 years, it was fantastic. After that, it it was time to move on. So I appreciate it. I can't knock anything about it. But our experiences, my experience is just as valid as those who say that, it's not their experience.
Thanks, Mark. Anyone else? Okay, so one of the other questions is interesting. If we want to see harm reduction as recovery, how do we talk about it in a context that's not separate from recovery? So not separating these two terms out. Is there a way to talk about it in a interconnected way? Anyone want to take that one on? Noel?
Gina, I believe looking at it as a pathway, when we talk about multiple pathways, right? It's multiple pathways to recovery, multiple pathways in your recovery. And, because not everybody on this panel has used the same pathway, right? And some individuals who are talking about, the 12-step groups, there's multiple pathways to recovery. You can go to the gym. You can work with horses. You can work with fish. You can work, with sea life. You can work on a farm. There's multiple pathways to recovery. And so being able to look at the different ways that harm reduction is a pathway. It might not be your pathway. It might not be somebody else's pathway, but it works for some folks. I know individuals that I worked with that, at one point in time, they were drinking 30 cans of beer a night. but through, hey, you know what? Let's try this. Let's try, the hard, let's cut the half. Can we go to half? All right, 15. All right. But it's being able to not just talk about, the harm reduction piece, but it's also, every one of these pathways, right? You have to look at how an individual works and how an individual wants to receive their recovery. Everybody's different. Everybody chooses a different pathway. I don't know what an NA meeting looks like. I don't know what an AA meeting looks like, but what I do know is when I got to the ALTER, that's where God, ALTEAR, my life, right? And I heard Phoenix and Mohawk, I heard you talking about it, right? There's different pathways. You had problems with individuals because of how they viewed you, because of their faith, right? But every pathway is different. I can't choose a pathway for you, but I can make the suggestion, hey, have you tried this? Have you tried this? And it's being able to say harm reduction is a pathway, but it's not my job to pick the pathway for an individual. It's not your job to pick the pathway for an individual. So maybe bridging the gap that way can help people understand that harm reduction is a pathway to recovery. Because I definitely know there are individuals that have tried harm reduction and have reduced their consumption, whether it was of drugs or alcohol or whatever other substance they were stuck on, they were addicted to, that the disease clamps on, and what they tried multiple pathways, whichever one works for you. You can start with NA, you can start with AA, you can start with non-secular, you can start with the horses, the gym, but ultimately, if harm reduction is what works for you, who am I to argue with that? Who are you to argue with that? It's to present it and let an individual make that choice. Let's give people their autonomy back. Let's stop trying to make decisions for people and let's let them make the decision for their recovery.
Thanks, Noel. So we only have 4 minutes left, and I want to give you all time to have any closing reflections that you might have on, this big topic of bridging that gap between recovery and harm reduction. And so, Kimber, I don't want to put you on the spot, but do you have any final reflections to share? And then we'll ask everybody else to chime in.
Yeah, I mean, I guess I do have a couple things. I think there were some questions that we didn't get to that I thought were really important to just touch on really quickly. Um, we a- anybody who's in harm reduction recovery, all these, coming from all these different places, there's like this big peer specialist kind of section of people cropping up. Like we have recovery coaches, all people with lived experience, or people with living experience. um, and I think something that's really important to me is just how are we supporting all of our peer specialists. You know not not everybody is, anybody that's a peer specialist that's going back into the workforce, working in recovery. um, there has to be, sometimes there's an abstinence requirement for jobs, stuff like that. You have to tell people when you are in recovery. I think one thing that we love doing at Safe Spot is, the only thing we're worried about, no matter where someone is in the recovery, is just keeping people alive. That if I have a super bad day at work, and at the end of the day, if I just say to myself, did anybody die today? And the answer is no, then I did my job. But anybody that we hire, we don't have an abstinence requirement for the job. We have people that come to us as callers, people that are still using, people that don't even qualify for a substance use, disorder. um, I think my biggest worry when I have people that are working for us are, if somebody is in abstinence-based recovery, um, I don't want somebody to be scared to tell me that they're using. People that are in long-term recovery that work for us, I'm in long-term recovery. I just want to make sure at the end of the day, if I relapse or if something happens, I can go to my boss and tell him what's going on without being scared to lose my job. And at the end of the day, no matter where all of us stand in this whole thing, I think the most important thing is just keeping people alive. So yeah, I think that that's definitely something I really would have loved to talk about during this panel. Just going through.
Thank you. So in the minute we have left, I will throw it open to Mark, Noel, and Mohawk to give your closing remarks.
Cool. Thank you. First of all, I just want to say thanks for having me on here. This was really cool. I think we could have actually done this in like a 4-hour time frame and still had the need for more time. But I appreciate everybody on this panel. Mohawk, just meeting you. I can't wait to talk to you again. Noel and Kimber, we're up here in New England, so we're always together. This is really, really awesome. And I appreciate the fact that while we are all here in this group right now, not one of us, our stories are never identical. No matter what pathway we took or are taking or may take down the road, nothing is ever identical. And I think that's what makes all of this so really, really awesome. That's it. Thank you.
Thanks. Phoenix, Noel.
Yeah, I'll just quickly say, I mean, there were a lot of good questions. I would have loved to be able to, I mean, there were even more things in our own outline that we didn't get a chance to speak on. So I've put my email in the chat. I've also just put some responses in the chat. But if if there's anyone who would like to just directly reach out to have a conversation, have any questions answered, like fully open to doing so. And if you don't know who I am or who I was before today, then, I can also kind of tell you about the things that I'm working on that I think, will really be helpful. And when we consider how we're trying to bridge the gap between all these different services that are related to, people who are using drugs.
Thanks, Noel. You get the final word.
Final word, let's not stop talking about it. Let's continue to educate the community. Ultimately, we the people, right? We're the ones that if we stop talking about it, lives get affected and continue to get affected. Let's continue talking about it. Let's continue to educate, those and truly, it's not about fighting with people, it's about educating people. If we can bring the correct information and educate the community, about the value of recovery from alcohol and other substances, and just educating the community about all pathways, and helping people shine a light on what's working, evidence-based practice, and right now, whatever a person can do to recover, let's bring it to that doorstep and allow them to use that choice, make that choice. Thank you guys for having me here, for being a part of this panel. And Regina, thank you as well. Rachel, thank you as well.
Thank you all. With that, I'll turn it back to Rachel.
Thank you so much. I realize we're at time, so I'm going to breeze through this. Regina, thank you so much for moderating panel. I do not have enough good things to say about all of you. I just very much appreciate your time. For our attendees, you will receive a follow-up email soon with a recording of the panel, along with a link to a feedback survey that my colleague Rebecca has posted in the chat. Please, if you can, fill that out. It helps us curate our content better for you and understand what we can do better next time and what we're doing right. So yeah, thank you again so much for joining this conversation. We will also endeavor to answer the questions in that follow-up email that we were not able to answer today. And they were all phenomenal. Thank you so much for your participation, everybody who was here. Yes, thank you for joining us in this conversation. Thank you, panelists, for the work that you do, participants for the work that you do, all of it to support recovery, reduce harm, and build more compassionate systems of care. And again, to emphasize, multiple pathways of recovery, abstinence, we support it, celebrate it, love it, harm reduction, support it, celebrate it, love it. So thank you all so much for being here. And with that, we will say goodbye.